Sharing information with insurance companies should not be required. Both job-based and new individual plans are not allowed to deny coverage, charge more, or refuse to cover treatments due to a pre-existing condition such as diabetes. Health insurance companies are required to cover pre-existing conditions anyways, so a patient's genetic testing information should not be required to be shared with the health insurance company. If a patient wants to share that they have a condition with the insurance company, the decision belongs to them. Also, the Health Insurance Portability and Accountability Act, HIPAA, of 1996 was established to protect patients' rights over their health information and set rules and limits on who can look at and receive their health information. Covered entities that must follow the HIPAA regulations include health plans and most healthcare providers. Health insurers and providers who are covered entities must comply with the patient's right to ask to see and get a copy of patients' health records. The HIPAA privacy rule sets standards and limits on who can look at and receive individuals' health information. HIPAA specifically states that a patient's health information should not be required and to submit to the insurance company without previous consent. If genetic testing is required to be shared with health insurance companies, then it could be a possibility that they will require everyone to get tested and share the results with them. This would mean health insurance companies would more than likely charge a lot more for premiums if they know all the conditions that their patients are predisposed to. Insurers have a better understanding of the risk pool, which increases the cost of premiums. If the risk pool would increase due to the genetic testing information was shared, then the cost may rise significantly. Should the results of genetic testing be shared with insurance companies, some issues still remain. Private insurance companies may refuse to pay for individualized drugs or refuse to insure patients that require individualized drugs. These actions may require government intervention to develop laws mandating insurance coverage of individually tailored drugs. Disadvantages of sharing genetic testing results may result in excluding coverage to populations requiring individualized treatment. The possibility of higher premium costs and exclusions creates a fear of loss of coverage, which has ultimately caused patients to refuse genetic testing. Refusal of genetic testing can cause a patient to undergo ineffective treatment, which can be costly for all parties involved. Other countries, such as France and Germany, have fully inhibited, or, such as Australia and Canada, have partially inhibited insurers' use of genetic information. So, if other countries are on board, why can't we? Say no to sharing genetic testing results with insurance carriers. Thank you.